Hello and welcome. Today, we're diving into a rare but serious condition called Reye's syndrome. This illness primarily affects children and teenagers recovering from viral infections. It's characterized by sudden brain damage and liver dysfunction. While relatively uncommon now, it's essential to understand Reye's syndrome, its causes, and how to protect your children. The exact cause of Reye's syndrome isn't fully understood, but there's a strong association with the use of aspirin to treat viral illnesses like the flu or chickenpox in children. While other factors might also play a role, aspirin use is the most consistently identified risk factor. This is why healthcare professionals strongly advise against giving aspirin to children and teenagers unless specifically directed by a doctor for conditions like Kawasaki disease. Reye's syndrome affects the mitochondria, the energy-producing powerhouses within cells. In the liver, this mitochondrial dysfunction leads to an accumulation of fat, causing liver enlargement and dysfunction. Simultaneously, in the brain, the disrupted mitochondrial function can cause swelling and increased pressure, leading to neurological damage. This combination of liver and brain damage is what makes Reye's syndrome so dangerous. Reye's syndrome is rare, especially in recent decades. This decline is largely attributed to increased awareness of the link between aspirin and the syndrome, leading to a significant reduction in aspirin use in children. While the exact incidence varies, it's considerably lower than it was in the 1970s and 80s, before the risks of aspirin were widely known. It's most commonly seen in children between the ages of 3 and 12, typically following a viral illness. The symptoms of Reye's syndrome can appear suddenly, usually a few days after a viral infection like the flu or chickenpox. Initial symptoms often include persistent vomiting and lethargy. As the syndrome progresses, more serious neurological symptoms can develop, such as personality changes, irritability, confusion, seizures, and even loss of consciousness. Rapid identification of these symptoms is crucial for timely intervention. Diagnosing Reye's syndrome can be challenging as its symptoms can mimic other conditions. The diagnosis typically involves a combination of factors, including a detailed medical history, physical examination, and various diagnostic tests. Blood tests are crucial to assess liver function and rule out other liver diseases. A liver biopsy may be performed to examine liver tissue. Neurological assessments, including a CT scan or MRI of the brain, can help identify brain swelling and rule out other neurological conditions. Lumbar puncture might be performed to analyze cerebrospinal fluid and rule out meningitis or encephalitis. Reye's syndrome doesn't have specific subtypes or classifications in the traditional sense. Its severity is often graded based on the progression of neurological symptoms, ranging from mild confusion to coma. The staging system helps healthcare professionals assess the severity of the condition and guide treatment decisions. There's no specific cure for Reye's syndrome, so treatment focuses on managing the symptoms and preventing further complications. Intensive care is typically required to monitor and support vital functions. Measures are taken to reduce brain swelling, such as administering medications like mannitol. Intravenous fluids are given to maintain hydration and electrolyte balance. Respiratory support, including mechanical ventilation, may be necessary. Medications to control seizures and manage blood sugar levels may also be used. Early and aggressive treatment significantly improves the chances of survival and reduces the risk of long-term neurological damage. The best way to prevent Reye's syndrome is to avoid giving aspirin or products containing aspirin to children and teenagers unless specifically directed by a doctor. Always read the labels of over-the-counter medications carefully. When your child has a fever or pain associated with a viral illness, use alternative pain relievers like acetaminophen or ibuprofen, unless otherwise advised by a healthcare professional. Educate yourself and your family about the risks of aspirin, and communicate openly with your doctor about appropriate medication choices for your children. The prognosis for Reye's syndrome varies depending on the severity of the condition and the speed of diagnosis and treatment. With early and aggressive intervention, many children recover fully. However, some may experience long-term neurological damage. Research is ongoing to better understand the underlying mechanisms of Reye's syndrome and to develop more effective treatments. Some studies are exploring potential genetic predispositions to the syndrome. Further research aims to identify biomarkers that can help diagnose Reye's syndrome earlier and predict its severity.